Welcome back to Daytime with Kimberly and Esteban. I'm Carla Salinas, and diabetes is a disease that is so prevalent here in the Valley. But today we're going to be heading into the DHR Health Heart Institute to speak to the doctors about diabetes and the effects that it can have on your heart. Today, we spoke with Dr. Michael Sewell, interventional cardiologist at DHR Health, all about diabetes.
Diabetes is impaired insulin secretion or insulin resistance. Type 1 diabetes is a problem with the pancreas actually secreting insulin and metabolizing glucose. Type 2 diabetes is due to insulin resistance and is a problem, of course, with glucose as well.
Dr. Sewell explains diabetes is associated with coronary artery disease.
It causes about double the risk of stroke. It causes peripheral arterial disease, and it can cause heart failure. And it can patients with diabetes have about a 2 to 5 fold increase of incidence of heart failure.
And although everyone with diabetes is at an increased risk for coronary artery disease or heart failure, there are some lifestyle modifications that can come a long way in reducing that risk.
Not getting diabetes in the first place can reduce it. But patients that do have diabetes, if they reduce their hemoglobin A1C, which is a measure of the glucose in the blood system, if they reduce that to a low level, say less than 7%, they also reduce blood pressure and they reduce cholesterol, then they have a 50% less chance of having complications from cardiovascular disease.
But DHR Health is always there to help you when you need it.
We see patients and kind of modify treatment as we need to, taking into mind that the patient may be diabetic, and help modify the risk factors such as high blood pressure, high cholesterol. We also screen patients for coronary artery disease, peripheral arterial disease, heart failure with various diagnostic tests. We provide education as far as lifestyle modifications, diet, and assistance with that. And of course provide treatment if the patient is to develop coronary artery disease or have a heart attack or have problems walking with peripheral vascular disease or have problems with their legs and have non-healing wounds or be at risk for amputation, then we see those patients and treat them appropriately in the hospital with interventions.
So the next time you reach for that cake.
Well, yeah, it's certainly, you bring up cake, but anything that has a high sugar content, certainly they should try to avoid with the goal of reducing their blood sugar. Because again, reducing blood sugar can contribute to decreasing the risk of these complications.
For more information, call DHR Health at 956-362-8677 or visit www.dhrhealth.com.